And hi everyone, welcome. Thank you for joining us again to Elevating Women in STEM Conversations on Bridging the Gender Gap podcast. I'm your host, Jovanny Perez. Sorry, I'm a little under the weather, so I promise I'm here, not a robot, but I'm gonna be under a mask, drinking my medicine ball. So yeah, and then before we begin, sorry if I butcher any part of your research or names or titles. I am not as delved into the STEM world as you are. So please forgive me ahead of time. But without further ado, I'd like to introduce our guest, Marlon Mejia. Can you introduce yourself for everyone here?
Yes. So my name is Marlon Mejia. I'm currently 6th-year PhD student at Baylor College of Medicine. Born and raised in SoCal though, so right now just spending some time in Houston for grad school. And I'm a middle daughter of 3 girls, so like women's health and that is important to me.
Oh, good. Thank you. So what inspired you to delve into your current field? Like, I know you've always been really focused on school, all that stuff. I know that's always been important to you, but specifically like what you're researching, which I know is like the reproductive tract microbiome. What to you makes that research really important? Like, what made you start into that?
Yeah, so I've definitely liked science growing up, and through high school knew I wanted some kind of health-related career. Knew I couldn't do physician work. Being a clinician, I'd be too emotional for it. So I was like, I'll do a behind-the-scenes kind of job. And actually, I mentioned having some sisters. So my older sister was diagnosed with her second and third of the 3 autoimmune diseases she has when I was in high school, and so that definitely came just in time for me to decide what I would want to do for my career. So that's where I decided I would go into some kind of microbiome autoimmune research field for college.
Oh, that's really nice. Yeah, I remember the first time any of them ever told me what you're doing. I was like, okay, yeah, I can never do that. Leave me with my buildings and bridges and airplanes. But that's a lot for me. But yeah, thank you very much. So on to question about your research and what you do. Can you explain your research on the vaginal microbiome and its connections to its autoimmune diseases like rheumatoid arthritis?
Yes. So separately, the vaginal microbiome is understudied. We have a lot of knowledge on other mucosal sites, so the gut, oral microbiome, even the lungs, but less is known about the vaginal tract. And anything that is really known is in the context of pregnancy and how to prevent infection of the baby or of the mother in that time period. So the vaginal microbiome definitely needs some more research. And then the autoimmunity part, again, I connected it because of my sister, and the fact that women have higher diagnoses of autoimmune disease, and so we're looking at what's different in women. Vaginal microbiome or vaginal tract is something different between men and women. And specifically rheumatoid arthritis, I think, is the second highest disease that's more prevalent in women. Lupus is the most dominant one. But in the reproductive age specifically is when we see that the rheumatoid arthritis is almost 5 times more likely to be diagnosed in women than men. And after reproductive age, that's when it kind of evens out. And so one thing we know about that age range is that the vaginal microbiome is different after puberty and before menopause. So that's kind of why we're targeting this time.
I didn't even know that, actually, because my family has experience with rheumatoid arthritis. Well, on the side of my dad, just after he got hurt in Afghanistan, he started to develop it, but I didn't know that it was more prevalent or common in women. That didn't even occur that was a thing for me. So wow. And then, so I understand you use mice, within your experiments. So how does using translationally relevant mice with human microbes help in your studies?
Yes. So one of the things that we're looking at, just kind of in general, also not in the autoimmune context, is when you're looking at pathogen studies, so infection models, you want to know whether the microbes that are in the host are relevant so that you understand how they respond to the infection, how well they clear it out. And so in the vaginal tract of mice, the composition is pretty similar, where one microbe is dominant as it is in humans, but the specific bacteria that's there is different. And so it's kind of something hard to reconcile with if you're like, oh, this is the immune response to a pathogen, or that the endogenous, so like the host microbes, are wiped out when you bring in this pathogen, you can't really say that in the mouse because it could respond differently than what a human would have. So with the lab next to us, well, we tried to develop a vaginally colonized mouse, and it did not work. So we went to the next best thing, which is a germ-free mouse colonized with gut microbes, and somehow the dissemination of microbes there was more relevant to humans in the vaginal tract as well. So now with this model that has bacteria of the same kind in the vaginal tract in mice as it is in humans, we feel more comfortable, right, pursuing these different questions of how does the endogenous microbiome change, which bacteria are more protective against pathogens, and then eventually I'll take my autoimmune work into a mouse model as well. But right now we're just trying to establish the model.
Yeah. Well, that's really good. That's awesome. And then overall, you know, to round up your research questions, I guess you could say, what impact? So you already talked about your what introduced or what drove you to do this, you know, with your family and being one of 3 sisters, and you know your oldest sister, of course. But what impacts do you hope bigger than that, or even, you know, you could touch on your family even more? That's always a great thing. But what impacts do you hope your research will have on women's health and just overall, and just aside women's health, just women in the STEM field as well?
So in the research specific part, I'd say that women aren't encouraged to talk about a lot of the things that they're going through. So when it comes to patient care, they're not bringing up issues that they have, and so the doctors wouldn't know about it. That's something I've learned with the women that I see in the clinic, because I collect samples from them and I interview them, is they'll talk to me as if like, oh wow, you're asking this question, I can talk about it, and no one's ever asked me before. So one of the things that actually led me to this question is the gastrointestinal symptoms that people with rheumatoid arthritis face, or if they have other autoimmune diseases could be facing. So they're asked about different organs or different bodily functions to keep in check, because so many other diseases are comorbidities with RA. And so that kind of led me to think of, there's these questions that the women are being asked, but they're not being asked about their reproductive health. So that's something that we want to expose the doctors to, and kind of encourage the women to ask their doctors about. So on a broader scale, I would hope that, because we have found some associations between RA and the vaginal microbiome, and inflammation there too, that it would be something that more doctors are asking their patients, and that they expand their care to take in gynecological symptoms as well. One more thing. But yeah, so that would be more on the clinical side. And so I guess one of the big things that we would hope for this is, as we learn about these different associations, we don't know the directionality of it, whether inflammation or infection impacts RA or aggravates it or induces it, or if it's the other way around, where the inflammatory state of the body is then driving the microbiome to be different, and then that leads to other symptoms and increased risk for STI acquisition or viral loads to be increased. So whether we find that maintaining the vaginal microbiome would help reduce flares and maintain RA, or the other way around, where say a woman's trying to get pregnant but has problems with infertility, the vaginal microbiome might be playing a role in that. And so do we need to maintain the RA for that to be fixed as well? And we understand too, in this, there are so many other factors with RA itself influencing reproductive health, or in terms of pregnancy and immune responses, or the other way, where pregnancy, because of hormones, changes RA. There are a lot of factors played into this. We're not trying to say that the one microbe we're going to find is the reason for RA in the world.
Solution or anything.
But we're just trying to find, like, how can we help people take better care of themselves and either treat symptoms or detect when a flare will happen. So,
that's great. I like that.
And just in terms of women in STEM, I think definitely in reproductive health, there are more women in that field studying it. So it's actually kind of like making other people more aware and informed. But I think still just like the work I've done, being able to talk to other girls about research path, or encouraging them to find something that they're passionate about, because research is very difficult and it's easy to want to quit. So having something that they're interested in, and so maybe this could be a field that they would be interested in as well.
No, I mean, I could definitely tell you that, you know, with the people that aren't aware and don't even think about this as common, I've definitely fallen to that, because when they told me about the research, I was like, what in the world is all this? Like, I didn't even know one and one could be put together. You know what I mean? So, like, I've fallen victim to that. So that, and then I see, I like that the importance. So, kind of something you touched on at the very beginning of making the talk about these things, like with women, whenever you go on, like for you specifically, going in to get a sample or anything, making it more common rather than it be like, you know, no one's ever talked to me that. So I really think that's important, because then, you know, you'll see a broader band of, well, these people are affected with it. Whoa, I didn't know these people were affected by it. So I think that would be really good.
And I would say too, a lot of the women that I see, so I am in 2 different hospital systems, one private with Baylor and the other one is the public general hospital, Harris Health, Smith Clinic. But the women there are predominantly Hispanic. And so hearing them, I think that was something that also, I went in with the preconception that they're not going to want to talk about their reproductive health, and they were very open about it. And so I had previously thought it's going to be a strain to learn about what they're going through, for them to feel comfortable, but they want to talk about it and get help. So I think that was a very important thing to see too, that there's a community that if we just assume they don't want to talk about it, we'll never help.
Well, that makes sense. Okay, so pivoting over to your academic journey. I'm sorry. This is going to be kind of like a 2-in-1 question. So I understand you began your academic journey at Moore Park, transferring to UC Irvine, and then finishing up here at Baylor. And so tell me about like what led you on that, as much or as little as you want to share. But then more importantly, did you, while going through that, and it's still going through that now, and even about to exit into the, I guess you could say, professional quote unquote field of it all, did you face any challenges as a woman in STEM?
So my career journey, or the academic journey, I think first it was difficult going to community college because of what other teachers were telling me. Is like, if you go to community, kind of like it's a waste, or you should have just gone straight to university because I had the grades for it. And so they kind of made me feel like, what kind of decision are you making? But honestly, going to community college first gave me more one-on-one time with my professors, who actually were the ones who told me about the field of immunology and microbiology, because I didn't realize it, and I thought I'd go into biochem, which I'm really glad I did not go into. But it was the direction of these professors who I got to know more intimately, and they knew what I wanted to do. And so they guided me in that sense, and gave me my first research experiences so that I could go into an undergrad, and even for grad school have had that on my track record. And then UCI was very helpful as well, because it is a more rigorous institution for research, and so I got exposure there. Got a good training for grad school to be like, oh, she came from a good school, an established place.
Of course.
And then Baylor too, I did not want to leave California originally, but the program and the people there were really good, so it was honestly a no-brainer to want to go there anyways, even though it meant a move. And then actually within Baylor is where I honed in what I wanted to do research on, because from senior year of high school I knew autoimmunity and the microbiome were important. And then in grad school is where I learned about rheumatoid arthritis having microbial connections, and then I rotated through a reproductive genitourinary lab, and then that's where I connected the two. So really, it's, even though I had a direction I wanted to go, every step of the way has kind of tailored exactly what I want to do in the future. And I know even now, when I think I have my like for sure goal for a future lab, I've been told by many postdocs it'll still change as you do more research. You'll be exposed to more. And then as a woman in the field, I think I've definitely felt like I had to prove myself, which I think also kind of brought up bad habits of like I guess just being on guard all the time, or not feeling okay making mistakes because I felt like I was expected to not do well, or I know I had one lab partner in community college who like would talk down to me, and I was just like, if I mess up, then I'm gonna prove him right, so I need to make sure I don't prove him right, and then that just kind of creates this very like an unhealthy way to approach things instead of just enjoying and learning, feeling fine making mistakes. So I think I'm trying to grow out of that and just do the work that I care for and not to make sure I stand up to anyone else. So that has impacted me definitely over the years of being in
It's kind of like reframing who you're doing the work for. It's not to prove other people wrong, but it's to help other people, kind of thing. And kind of like what you touched on, like something we say in the Army is no plan's ever gonna go perfectly. You're always gonna have to change it. So I get that. So then overall, I guess at the end of this, what would you say is your ultimate goal? If whether it be a goal you know is impossible but you want to reach as close as you can, or something you can reach, whichever one you want to choose, both for your research but also for maybe something you haven't thought of before, or you have, or just the advancement of women wanting to go into your field or just the STEM field in general.
I'll answer the last one first and say that I do want to be mindful of not making all women go into STEM, and being able to learn how to encourage whatever their pursuits are, and for those who are in STEM, letting them know that whatever other interests you have could be incorporated as well. So I know I've seen a lot, especially with a girls' summer camp that I worked with, is how to help girls be fascinated with art and STEM, because there's a lot of beauty in what we're doing, either when we're researching, what we're learning of nature, or how you present your work could be very artistic too. So just helping women know that it's not exclusive, all these different fields. And so I guess like encouraging them in that way. And to the first question being, what kind of goal do I have for myself in my research? I'd say I definitely want my work to be translational. So that means whatever we're developing or learning is directly applicable to the clinic. And we're learning from the clinic, getting clinical samples versus just working on everything in vitro, the cell culture, and making this like, oh, everything's going to respond this way. So I would really like to have a robust sample collection process, or where I can get more people involved with different institutions. And I have friends who are residents and will be having their own practices as rheumatologists. That I'm like, wherever you guys end up and have your practice, send me samples. Or other girls who might have, so like I right now have a mentee who wants to do reproductive health as her grad school when she applies to grad school. So she's kind of going more of a basic immunology route, but still, if I can get her help too. So I am a very big people person. So having just all these networks come together that I've developed along the way help me with my research question, which ultimately helps other women. I think is the dream.
Bridge the gaps.
Connecting everyone.
No, that's great. Well, prayers and all that, to your goals, to both for the people, for you as an individual, but also for the people that you're gonna like really impact in the future. So I pray for that, and I know it's gonna go well. But overall, thank you for being here. Thank you for our listeners who joined in last minute. This was an amazing talk. Hopefully you guys got anything out of it. I know I did, because I learned a lot of new things that I didn't know about before. But thank you very much again, and hopefully we get to see you soon.
Thank you so much for having me. I appreciate this.